I would thank my family for their support to reach to this level and to continue even my journey further. A special thanks to my father who supported me throughout the journey, even when I selected emergency medicine.
Welcome everyone to another episode of our podcast. And in this episode, I'm going to concentrate on a particular demographic of young emergency physicians, young leaders in emergency medicine. In this particular demographic, we're going to talk about one of my friends and colleagues, Dr. Lateefa Aidam. And I welcome Dr. Lateefa to this episode.
Thank you for having me today.
What I'm going to do, we just want to talk about, because this is a slightly unusual, we talked about emergency medicine a lot, and we can talk about that. But I want to talk really about your personal journey a little bit. I know your career a little bit from, my own knowing you. And I'm just interested in what got you into emergency medicine. I mean, medicine is common, but what was the start? What made you interested in it? And so let's start with that and then we can take it forward.
Sure. When I was a kid, I was dreaming to be a lawyer.
Oh, okay.
So my dad forced me to go to medicine and I ended being a doctor. So when I was in my internship period, I never knew what I want to do next. So during the internship, as you know, we rotate in all the rotations. So I selected emergency as my elective rotation. When I started emergency, I was like impressed. Wow, ED physicians are working as an investigator. They look at, they are not only diagnosing the issues, they look at people, they are integrated even with the family, and then sometimes they look for, this quick diagnosis and intervention. I felt like, I think I see myself as an emergency physician.
Right. So I want to take that further. So you basically made a decision, which is interesting, during your emergency medicine rotation. Was there any particular role model that you saw that really impressed you? Because I know that people selecting specialties often they don't do it for the specialty; they do it for people. Yeah. Now, this may or may not be true, but I'm just thought I'd explore that a little bit.
Actually, during my internship, we had something called physician career fair. So I said, let me go and visit that career fair. So there I met Dr. Nuruddin.
Yes.
He already started the emergency residency program at Tawam. It was the first year when they started that residency program. So I was impressed that in ED, they do intubation, they do central line, they work day and shift night, which fits me actually as, I don't like routine work. So I said, let me go there. And I selected even Tawam residency program because of him.
Right. Okay. Interesting. And absolutely right. I mean, I think that, I'm just going to explore a little bit more about personalities because, emergency medicine needs a particular type of personality. So generally, it's well known that we don't have an attention span. We're not interested in a routine. We like changes. So tell me a little bit more about that aspect of your personality.
See, people were telling me, Lateefa, you won't survive an emergency department as you are too kind and too calm. But I do believe that it's one of the most important things that ED physician, almost all of them are really calm and, I don't know how to say it, but really patient.
Yes.
And I think this is one part. The other part, I think, decision making.
Yes.
Usually I like taking decision quickly, which I think as ED physician, this is something as well very crucial and really important.
Yeah. So great. I mean, that's really good. And so you got into the residency program and you progressed through it and you developed and you had an initial impression. Did that change at all? Were you more impressed, or you pretty much expected? You're a strong personality, I know, and so you knew what you were going to get into, and there was no surprise.
Actually, as first year resident, I was traumatized. I thought, when I was seeing my senior taking fast decision, they move between the cases, like a case of STEMI, then on the other hand, a case of sore throat, for example.
Yeah, minor things.
I was like, I might not be able to really do it. But then when I was rotating to other rotation other than emergency department rotation, I was like, every time I rotate to another department, no, I need to go back to my place.
Yeah.
So I believe, in the beginning, everything, when just at the start, you feel it difficult, but once you progress, you find yourself in the right place and correct place.
Yeah, very good. So, you were obviously drawn to emergency medicine, and whenever you compared it with other types of work, other types of specialties, you actually missed it more.
Yeah.
Yeah, definitely. Okay, great. And so then, you've when you finished, did you have any particular ambitions or long, view on how you want your career to go? I mean, I'm just curious about that. Or you just took it as it, as the.
Actually, I was planning to go toward the educational side more. I love teaching, and during the residency, they teach us how to be an educator. So I was thinking to go to the education path. And to teach in a university, and introduce. I believe in teaching, and I believe that teaching is really something good. But the track ended me up going to the other side as well, to be an administrative.
Yeah. Well, I mean, I think, my own experience, I think part of, working in a department and improving the quality of the work being done is that you do need to, concentrate on education or continued education, because as you, I think, highlighted, emergency medicine is a difficult specialty in the sense that you need to know a lot of stuff. It's not, you don't need a lot of stuff about something little. You need to know a bit
of everything.
Actually, quite a bit about a lot of things. And in fact, medicine is so wide that it is a challenge. So education is part of it. So all your people working with you or whatever, we need to constantly stimulate them. Educationally, let them. So I think, in a way, your education interest comes well with that, mixes well with that.
Yes, I totally agree with you. Actually, even if you want to be a good leader, you need to be a good educator as well, as you said. So yes. I believe both comes together.
Yeah, I mean, as you probably know, I mean, I was worked in the same department that you've worked, and we worked a lot on education, and we were doing a lot of regional stuff. And I mean, I'm sure you heard about it, so I don't need to mention that. But the thing is, and I think also I've heard now, I'm seeing that you've taken things forward. You've taken all that legacy and you're actually moving it forward, which I'm really pleased, because I think there's two things I really believe in, which is essentially the service has to be led eventually by somebody local, because they have the buy-in long term to actually improve the service rather than people coming and going. So I'm really pleased that way. And then on top of that, being a lady, obviously, you bring something special to administration as well as, maybe the department. So tell me a little bit about, I know you're doing some leadership stuff with the government, and so tell me about how that, how the leadership stuff is going and how you're finding that.
First of all, thank you for starting all the work you have been doing in the department. When I joined SKGH, a few of the things were already, or a lot of things actually, were done thanks by you. But then, as you said, the journey need to be continued. And so as you are aware, I think already you know that we had the STEMI network with the
yes.
Northern Emirate region. We extended that to stroke networking, trauma networking, and planning even other alignment of the services, as you know, disaster preparedness and other things as well. To the leadership, as physician, or as an emergency physician, let us say, we are already practicing leadership within the shift already. You know, when you are
course.
taking care of your shift, then you need to take all the decision within that shift. So I believe I'm biased to emergency physician. I think we are born leader. So, or we are working on the leadership skill. So I think with the support of the leadership as well, I think I have learned quite fast.
Excellent. I mean, I'm actually, I'll agree with you. I mean, this is going to be an agreement discussion. I think we're going to agree constantly. But the thing is, I would take it further in the sense that I always thought that, and I think it always doesn't happen, but it doesn't always happen. But I actually think the emergency physician, trained emergency physician, is the best person to lead the hospital. Because I feel that you, as an emergency physician, I'm not talking me or you, we understand managing a lot of patients. We understand flow. We understand efficiency much better than a neurologist or a ophthalmologist, because they just focus on a little bit of their skills. So I think eventually the organizations, and I know that the best, most successful hospitals in North America, USA, and places like that are actually run by emergency physicians. So, and I think that's a good ambition for a young Emirati emergency physician. How do you see, and do you agree with me, first of all? And if you do or don't agree, how do you see it? How do you see the role of an emergency physician in the organization? In making cultural change and other changes. I think you've already done some work on that with the networks you're talking about.
Yeah. First of all, I totally agree with what you said, because we are emergency. No, just joking. Because as you said, we know a little of everything, so we can gather everything together first. We are quick decision maker, and we know the exact correct time to take the decision. So I believe if you look at any network, the work can't proceed without involvement of any of a physician, emergency physician. So I believe we play a core role and changing the organization and enhancing further improvement within the organization. So I believe, yes, I think, yes, emergency medicine is a new field, but I think people started appreciating it already.
Yeah. I think, okay, I'll come to slightly, talk about something slightly different, which is the challenges, because I think with a new specialty, there is some difficulties because there's some pushback or resistance from other, established physicians. How do you deal with that? How do you do it? I'm sure you have a special way of dealing with people. How do you see it? What have you learned in the years you've been doing this work?
It's really, that it's really challenging. Mm-hmm. Sometimes I start involving them with our educational part to show them exactly what is emergency medicine means. Sometimes I involve them with the drills that they know exactly the level of emergency medicine, and we work together as a team. I think by time people started understanding that, yes, emergency physician is not a general practitioner anymore. A trained emergency medicine personnel can do the work, then they can actually save lives, and they are the core people actually within the hospital setup as well.
Absolutely, and absolutely, I agree with you. I mean, I almost like view. If you look at emergency medicine, it's a department, and then there's the hospital, further up. And I personally don't like that mental model. I like the emergency department, the center, and the rest to be, spokes of a wheel. So we're in the middle. So we manage and we control what's happening. And that's my sort of mental model of that. How do you have a similar model or a slightly different way of looking at it?
I totally agree with you. I think we play the core area, the core place, the core people. I think if emergency physician treat the patient well, give the service in a good way, I think the whole hospital will follow it, because I believe a good hospital are run by a good ED physician.
Excellent. Yeah. So obviously you're still a young compared to myself, young doctor. Maybe you don't feel that way, but you are. So how do how do you personally intend to, or develop yourself further as this years go? How are you going to take on? Do you have any ambitions on that? Or do you have any ideas how you're going to do that?
Actually, it's a difficult question. All of us have big dreams. But the most important thing, I believe, that if you are in one place, just how you do changes, whether you were, leadership is not a title. If you are even a normal physician within a department, you could do changes.
Indeed.
But again, I attend a lot of leadership courses. I read a lot. I listen to a lot of expert people within leadership, not only within healthcare sector, but even outside of healthcare sector. And I definitely talk to my senior all the time. And, I look at the decision that I make usually, and then I
reflect
on, whether that decision was correct or not.
Yeah, I think you can't make every decision right.
Yeah,
you've got to learn.
Definitely.
Absolutely. And you need to be humble enough to say, okay, that was not the right decision. Now we can change things a little bit different, go a slightly different direction or whatever. So I think that's a fair thing to do. So something, another as a leadership thing, I think you may have read, you do a lot of reading. So a lot of this, we talk about mentors, or coaches, we talk about the top athletes in the world, top tennis players, top whatever. And they have a coach, and they're like, you're the best player in the world. Why do you need a coach? But sometimes you need somebody, on the outside, look at, and you then ask them, and they can give you some feedback. I'm not saying they guide you, but they give you feedback. So is this something that you think is useful? Is it something that you have in the system? Have you got somebody that you think, okay, this is the person I will ask or talk to or discuss and reflect on?
Actually, I am one of the people who believes in such coaching system. I have one coacher who was coaching me during medical school. Until date, I'm talking to him. And each level of my career, I develop even coaches. I know when I have a certain issue, I know whom to call.
Yeah.
And I believe, yes, you need that support. You need people to guide you. And sometimes you take a decision, and then, you need someone just to let you know if that decision was correct or not.
Yeah, I feel for you. In the sense that I know being, in a leader of a department, the responsibility is great, and it's a lonely place because the people, below you don't always feel for you. They don't have the same. They don't really realize what you're going through, what you're facing. So it is. So you do need that, and I'm glad that you're saying that you have that. Whether it's within the organization or outside, it doesn't really matter. It's as long as it's somebody you trust and they trust you, and they can be honest with you and you can be honest with them. And I think that's important to balance your career and your work-life balance. Obviously, it's really good. So I just what else do I want to talk about? So much to talk about, really. But what's next for professionally? Not for you personally, but for the department. What are you looking to make or change that you think that's the next 5 years? Or I wanna if I could do this, whether you can when can achieve it or not, that would be really good, or head towards that direction.
I'm really dreaming to expand the emergency department. As you are aware, we are a general hospital, but the population is increasing, and UAE is an open country. People come and live in UAE, so the population increase yearly. So I dream to expand the capacity of our emergency department. So this is something I dream about.
Okay, all right, great. It's good. Yeah, definitely. I think it's already expanded. From when it started, I remember before I actually joined even, it's actually expanded. The number of patients has increased, and I'm sure it's year on year that's continuing. And and it's good that you've you're going to look at innovative ways of of expanding that service and making the service even better. So that's really good. And so, what do you want to add something from your side about your career, about how things are going, that you want to sort of tell us about?
Really, I would thank my family for their support to reach to this level and to continue even my journey further. A special thanks to my father who supported me throughout the journey, even when I selected emergency medicine. As you know, it's a place that really difficult, especially for a female lady. But my family really supported me, and my family, my friends, my mentor, who really supported me throughout the journey.
Yeah.
So I
So I
would
think that's,
really,
yeah, absolutely. So that's I think it is. We forget sometimes how important that aspect is, because we always talk about professional aspects developing from courses, exams, training, whatever. But in fact, a lot of the decisions that you make are based on outside factors like family. So I think I'm glad because in order to achieve what you have, I'm sure you had great support and will continue to have, because it's going to be an important aspect, of your going forward. So I'm glad you to hear that. Thank you, Dr. Lateefa, for being part of this episode. It was very, very interesting discussing your journey through life, through emergency medicine, through leadership. And I think I would like to thank you for being part of our program. We learned today about the leadership role that is being played by Emirati ladies, particularly in a field like emergency medicine. Many fields, but in particular a field like emergency medicine, which is a telling field. And I'm sure I was actually, in fact, maybe not all people would know, but in the last board elections for the Emirate Society, which I was at, I was pleased to see that the whole board is female, and that's unusual in the world, I think. And I was actually pleased that is something that's happening, and it's a change in the society and in emergency medicine and professionally that I think I welcome. So, and you're part of that sort of movement, if you will. So I'm really pleased and for that, and I hope this will serve as an inspiration to many other Emiratis and ladies. Thank you for coming.
thank you.